Hi, and welcome to our third webinar, How to Make the Most of Your Employer Benefits While You Are in Residency. I'm Dr. Josh Lumbley. I'm a board-certified anesthesiologist, and I am also a strategic advisor for Doc-to-Doc Lending. Today, we're going to explore the benefits that are offered to residents and how you can use them to improve your financial health and well-being. As we have discussed previously, this presentation is for informational purposes only, and it is not financial advice. Every residency program is going to offer unique benefits, so please take time to review them, schedule an appointment with your HR and benefits office, and make sure that your specific package is accurate and appropriate for you. Okay, so let's start off at the top and look at an overview of employer benefits. So it's not just a paycheck that you're taking home. You are also receiving benefits when you're an employee in your residency program. Those benefits include critical financial tools, as well as personal support that can make a significant positive impact in your life during residency. Of course, at the top is the most important one, and that is health insurance. This, of course, is going to provide essential coverage for medical expenses. Beyond health insurance, we also have disability insurance. You may not think about this, but disability insurance is going to protect your income if you are unable to work due to illness or injury. And then I realize it may be low on your priority list, but there also is the opportunity for participation in a retirement savings plan. This is going to give you a chance to start saving regularly and early and start planning for that future. But beyond just health insurance, disability, and retirement, there may also be other benefits that are offered by your benefits program. Those include continuing education, which might cover conferences or other certification that you might receive above and beyond your residency training. Wellness programs. So maybe there is a discount at a local gym, or maybe there is a discount for counseling or financial services. And then finally, for those of you that have families, your residency program may offer some benefit for childcare assistance. Understanding what is available to you beyond just the bare minimum of health insurance, disability, and maybe your retirement is really important. So again, that's why I encourage you to schedule a meeting with your human resources or benefits office to see what's available for you, because that, of course, can improve your overall experience during residency. So let's start with the biggie, health insurance. And what are your considerations for health insurance? So it is going to be the most often used benefit during residency, and it also happens to be probably the most important. Premiums are going to be your monthly costs. A lower monthly premium might be appealing to you, but often it comes with higher deductibles and co-pays. So if you are going to visit the doctor a lot, a lower monthly premium may not be advantageous for you. Deductibles. This is the amount that you're going to have to pay out of pocket before the insurance kicks in. So it may be $1,000, it may be $1,500, it may be $500. You're going to want to look at your specific plan. And then finally, staying in network or out of network. If you utilize an in-network provider, that is going to save you money. Now, many of us will have high deductible health plans or HDHPs. That puts you eligible for contributing to a health savings account. A health savings account allows you to save pre-tax dollars for medical expenses. Again, you're always going to want to look at your own individual situation. What is your total cost of premiums? What is your total deductible cost? And what might be your out-of-pocket maximums before you decide on a health insurance plan that's appropriate for you or potentially your family? So now let's think about something that might be commonly overlooked, disability insurance, and what you should consider as appropriate for you. So at a high level, disability insurance is going to protect your income in the case of an unexpected illness or an injury that's going to prevent you from being able to work. So for a resident, this is really important when you think about the time, the energy, and frankly, the money that you put in to getting to where you are in your medical career. Many benefits programs are going to offer discounted plans that are tailored to medical professionals. So if this is offered, you're going to want to take advantage of it. And when you are reviewing a policy, you're going to want to consider a variety of factors. Number one, the coverage amount. Does it replace enough of your income? Number two, the elimination period. How long do you have to wait before those benefits start? Is it 2 weeks? Is it a month? Is it 6 weeks? There's going to be a time period that's tied to waiting before the benefits begin. And then finally, does your plan offer specialty specific coverage? So this is going to ensure that you're covered if you cannot practice in your trained specialty going forward. So in closing, the safety net of disability insurance is often overlooked, but it is one of the most important benefits that you can secure during residency training. Okay, retirement. You may be saying to me, Josh, that's like 30 years away. Why should I worry about retirement? Yes, you are right. It may feel like a distant concern, and it is a long way off, but starting early does make a difference. And here's why. Number one, compounded interest. So the idea of time in the market versus timing the market. Contributions are going to grow exponentially over time, but you've got to leave it in for a long time. For example, $100 invested monthly with a 7% return annually can grow to over $120,000 in 30 years. Beyond compounded interest, there are also tax benefits to potentially participating in a retirement plan. So plans like a 401k or a Roth IRA might reduce your taxable income or allow for tax-free growth. And then finally, you might be lucky enough to be at a residency program with an employer that offers an employer match. So some programs might match a percentage of your contributions, effectively doubling your savings up to a certain point. So in this case, even small contributions during residency can create a small foundation for long-term financial stability. So an employer match program is one of the easiest ways to boost your retirement savings. You may be saying, I hear people talk about $1 up to 3% or 6%. What does that mean? So here's how it works in practice with a pretty simple explanation. So let's say your employer offers 100% match up to 3% of your annual salary. So if you're going to contribute that, you 100% want to be able to do it. So for instance, let's say your salary is $60,000. 3% of that salary is $1,800. If your employer offers a 1-for-1 match, 100% match up to 3%, that means you contribute $1,800 and your employer contributes $1,800. That's like a raise or a bonus of $1,800. So even if you are tight on cash, if your employer offers a full match up to a certain point, you should 100% take advantage of that. It is basically a bonus or extra income. And of course, as we've talked about, automate, automate, automate. If at all possible, you want to make sure that you're automating your savings to make that whole process seamless. So we've talked about health insurance, we've talked about disability insurance, and we've talked about retirement benefits that your employer may offer. There may also be additional perks that your employer offers that you may want to take advantage of. These are going to go beyond the basics, and they can significantly improve your overall well-being, your mental health, and just general quality of life. So what might be some of those benefits that your employer would offer above and beyond insurance, disability insurance, as well as the retirement benefits? Well, they may offer a CME or continuing education fund. So you may want to use this for attending conferences, national meetings, participating in additional certification, or just board certification preparation materials. Childcare assistance. Those of you who have children know childcare expense is really costly. So having the opportunity to have a pre-tax contribution for childcare can reduce that financial burden. And then finally, maybe your program offers wellness programs. So this might include discounts for gym membership, counseling services, EAP programs, mental health support, or even just financial services. It's really important that you carve out some time to meet with your human resources or benefits office to see what they offer above and beyond the basics of health insurance, of disability insurance, and retirement planning. There may be options available that you are frankly not even aware about. So take some time to educate yourself on the entire benefits packet. And finally, please do explore all the resources that Doc to Doc has to offer for Match Day. We are here to help you maximize your financial opportunities during residency. If you've enjoyed this video and you'd like to look at other educational resources like that, please visit doctodoclending.com/matchday to explore the tools, the resources, and the financial literacy training that we offer, which is specifically designed for medical professionals like yourself. Thanks so much for taking the time to join us today. I hope you have enjoyed this session.